Thank you, Doctor, for the introduction. Assalamu alaikum wa rahmatullahi wa barakatuh. مساكم الله بالخير جميعا. So I talk about the effect of fasting on lipid profile and cardiometabolic markers in patients with diabetes. So our focus here on the intermittent fasting as one of the most commonly practiced regimen nowadays. Intermittent fasting is simply a kind of intermittent abstinence from food or eating food, drinks for a certain period of time in which the subject is alternating between fasting and feasting within the 24 hours or over the days of the week. Actually, we have different forms of fasting and different forms of intermittent fasting. Among these is the caloric restriction, in which there is a kind of significant reduction in the total caloric intake by about 25 up to 40% of the daily habitual caloric intake. We have other forms of intermittent fasting, including time-restricted feeding or eating, periodic fasting like 2 and 5 days, like Monday, Thursday, from Islamic perspective, and there is what's called the intermittent or fasting mimicking diet. It's not working, this pointer. So fasting is not a kind of abstinence from foods and drinks. Fasting is actually a kind of like a holistic change in different dimensions in the human life and the human body. Among these is the change in the gut microbiome, change in the circadian rhythm and the circadian clock, and the hormones that are regulating our circadian rhythm, changes in the dietary and lifestyle behaviors, including the quantity, quality of the food, physical activity, and sleep. And all these are accompanied with concomitant changes in many metabolic, inflammatory factors like lipid profile, insulin and glucose homeostasis, satiety hormones, inflammatory markers, and cytokines. And all these at the end will shape the risk of developing diabetes, cardiovascular disease, and even cancers. As mentioned before, there are many actually comprehensive systematic reviews and that highlight the significance of fasting in health, disease, and aging. Among these, the one published in the New England Journal of Medicine, showing how intermittent fasting affects our health. And here, our concern is about the metabolic switching that characterizes the intermittent fasting, in which the body switches from the glucogenic into the ketogenic metabolic pathway. And this ketogenic pathway has been shown to be associated with increased insulin sensitivity, decreased insulin resistance, increased antioxidant defense, and all these represent protective factors against the cardiometabolic disease. Another review in Science Journal shows the different multidimensional effects of fasting on different body systems, organs, all show a positive impact on the human health, including the cardiometabolic risk factors. And this is also another one showing how fasting in the human decreases the resting heart rate, decrease oxidative stress, lower the triglycerides, LDL, and other cardiometabolic risk factors. Most recently, this is a very comprehensive review in physiology of fasting, showing how the multiple factors related to cardiovascular health, heart, are improved by the observance of fasting. One of the main factors that characterize the fasting is the improvement in the glucose homeostasis, and this is directly related to the condition of dyslipidemia and the lipid metabolism as well. It has been shown that fasting decreases the blood glucose, fasting insulin, improves the insulin sensitivity, as I mentioned, decrease the weight loss, decrease the adiposity, glucose 1 secretion, and glucose tolerance. And all these have been shown to be associated with improved cardiometabolic risk factors. So once we talk about intermittent fasting, Ramadan fasting is one of these forms, and the most commonly practiced of intermittent fasting now is the religious fasting of Ramadan. And the recent classification, I think that Prof. Hassanain, you were one of the panel discussion who defined the fasting and the prolonged fasting, and now it's described as the intermittent dry fasting, actually, to be distinguished from the other forms of fasting. So what about the Ramadan model of intermittent fasting? I will here go through the our previous systematic reviews and meta-analysis we have done on the healthy people to show how Ramadan fasting affects the cardiometabolic risk factors. This is our first systematic review and meta-analysis on the metabolic syndrome components, showing that over 85 studies, over 4,300 subjects, there was significant improvement in the metabolic syndrome components, including significant reduction in the fasting glucose, triglycerides, improvement in the HDL cholesterol, systemic blood pressure, total cholesterol, and LDL cholesterol. Other meta-analysis on the cardiometabolic risk factors also we have done shows that also Ramadan fasting is associated with significant improvement in total cholesterol, LDL, slight improvement in the HDL, VLDL, very low density LDL, was also decreased by the end of Ramadan fasting, as well as triglycerides with improved diastolic and systolic blood pressure. Body weight, which is one of the main risk factors for the cardiometabolic health, has been also shown to be improved in our meta-analysis. Over 85 studies, including more than 4,000 subjects who observed Ramadan fasting, showing that Ramadan fasting was associated with significant but slight to moderate reduction in the body weight. Discussing the effect of Ramadan fasting on the glucose homeostasis markers, which are also determining factors for the cardiometabolic health, showed that over than 3,000 subjects observing fasting, it was associated with a significant but slight reduction in leptin, significant but a slight improvement in adiponectin, increase in the serum and insulin as part of the normal response to healthy normal people, slight decrease in the HOMA-IR insulin resistance marker, and all these also indicate for a good impact on the cardiometabolic risk factor. Body composition and body fatness also improved significantly by the observance of fasting, by significant reduction in the total body fatness and total body fat amount. Inflammatory markers, which are also one of the cardiometabolic risk factors, have been shown to be improved significantly by the observance of Ramadan fasting. And one of the most prominent factors and effects is the significant reduction observed in our study on the visceral fat, which is the main cardiometabolic risk factor, upon the observance of fasting, and the significant reduction in the visceral adiposity index we found by the observance of Ramadan fasting by about 60 subjects with overweight and obesity. This is a part of our study, significant reduction in the insulin-like growth factor, significant reduction in inflammatory interleukin 6, TNF-alpha, significant improvement in the anti-inflammatory factor interleukin 10. Our most recent study on the ceramides and sphingolipids using the lipidomics technology, we found also Ramadan fasting was associated with improved level or status of many of the ceramides and sphingolipids and inflammatory markers by the observance of Ramadan fasting. Using proteomics also showed another significant improvement in the metabolic syndrome components at the proteomic level by the observance of fasting. So all these factors show that fasting is actually protective for the healthy people by lowering the risk factors. Our meta-analysis also on the inflammatory markers and oxidative stress markers showed that TNF-alpha, interleukin 6 were significantly decreased by the observance of Ramadan intermittent fasting, along with significant reduction in the TNF-alpha, as I mentioned, interleukin 6, interleukin beta, and CRP, as well as the marondildehyde as a marker for the oxidative stress. Liver functions also as part of the cardiometabolic risk factors improved by the observance of fasting by significant but slight reductions in different liver function tests like ALT, AST, bilirubin, LDH, and prothrombin. So what about the other forms of intermittent fasting and the cardiometabolic risk factors? This narrative review showed that different forms of fasting, including the time-restricted eating, 20-day fasting, intermittent energy restrictions, have mixed effects on the cardiometabolic risk factors. and more robust, controlled long-term research should be conducted to have a clear impact for the different forms of intermittent fasting on the cardiometabolic risk factor. One of the most important studies, actually, I have found on the effect of different intermittent fasting on diabetic patients or patients with diabetes with regard to different cardiometabolic risk factors. They showed that there was a slight effect on the different lipid profile components, a slight reduction in total cholesterol, LDL, triglycerides, with a slight reduction in the HDL by the observance of different forms of intermittent fasting by patients with diabetes. Another meta-analysis showed that the observance of the intermittent fasting regimens by metabolic syndrome patients and the pre-diabetic patients showed that there was significant reduction in the total cholesterol, triglycerides, LDL without having a significant change in the HDL. Going now to Ramadan and diabetes, which is part of our discussion, the most important systematic review and meta-analysis I found by Taha Pari on 28 observational studies, including 11 studies with more than 3,700 patients with type 2 diabetes, showed that there was an improvement in the lipid profile components by the observance of Ramadan fasting by the fasting in comparison to the pre-fasting. It was also found to be associated with decreased total cholesterol, LDL, triglycerides, and a slight improvement in the HDL cholesterol by the patients with diabetes who observed Ramadan fasting based on these observational studies. These are the forest plots showing the different effects of Ramadan fasting on the lipid profile. Another systematic review on the effect of Ramadan fasting on patients with type 2 diabetes also showed mixed effects. Over 17 studies, there was a wide variation and high heterogeneity for the effects of Ramadan fasting on the lipid profile and other cardiometabolic risk factors. In these studies, 15 studies showed that the results were inconsistent in this review. 4 studies reported significant reduction in total cholesterol, in contrast to 2 studies in Algeria showed improvement or increase in the total cholesterol. 5 studies showed significant reduction in triglycerides, and 2 studies reporting significant increase in triglycerides. 4 studies showed significant decrease in the HDL, while 2 showed increase in the HDL. 4 studies reported decrease in the LDL, in contrast to 3 studies reporting increase in the LDL. So there is like a mixed effects because of the observational nature of these studies included in these systematic reviews and meta-analysis about the effect of Ramadan fasting on the patients with type 2 diabetes. For type 1 diabetes, there is, I'm sorry, the reference is not appearing here. Also, there was no clear change actually observed in the lipid profile in on patients with multiple daily injections during Ramadan. Another systematic review on 22 studies on type 1 diabetes, 17 studies reported variable changes in the lipid profile and cardiometabolic risk factors. What supports these results that there is no significant increase in the emergency incidence of cardiometabolic events like cerebrovascular disease or cardiovascular disease events, myocardial infarction and others at the end or after Ramadan, which supports that there is no association of Ramadan fasting with the predisposing factors for these CVDs. Again, the improvement in insulin and glucose homeostasis, and what we showed in our meta-analysis that the reduction in leptin, improvement in adiponectin, all these could be among the factors that may explain these positive changes reported in some studies about Ramadan fasting and cardiometabolic risk factors. Recently, the effect of fasting on the what's called the beiging of the white adipose tissue and the increased mitochondrial concentration in the white adipose tissue by the observance of fasting, which is concomitant with the change in the gut microbiota. All this may explain the slight improvement observed in some studies about Ramadan fasting and cardiometabolic risk factors. Our studies on the dietary index of fasting show that fasting is just a kind of like a rescheduling of our meal time, meaning that there is no significant change actually we found in the total caloric consumption from carbs, proteins, and fats. And in most recent meta-analysis on the dietary macronutrients and caloric intakes about Ramadan fasting, we showed that there was no major changes. As you can see here, most of the studies showed no change in the energy, carbohydrates, fats consumption, protein consumption, while there was increase in the water and fiber consumption, which means that it is kind only of a change in the timing of the diet rather than a drastic change in the macronutrient consumption. This is under publication. A study also on the different food groups also showed mixed effects for the observers of fasting on the different food groups. Time is limiting, so I have to end by saying that many factors during Ramadan affect our cardiometabolic risk factors. The change in the dietary lifestyle behaviors, exercise, nocturnal light exposure, a shift in the meal time, all these things also contribute to the effect on the cardiometabolic risk factors, maybe contribute negatively, actually, because we have also reported a reduction in the sleep quality and sleep quantity by the end of Ramadan fasting. So there are many sources of heterogeneity in these meta-analysis, and these sources including the different days of fasting. The fasting in winter differs from summer, from spring. The day of fasting hours also affect from 12 up to 20 hours of fasting per day. All these have different effects on the outcome. The weather regarding temperature, humidity, for the quantity and the quality consumed during the night hours, sleep patterns, sleep quality, all these are not controlled and even not mentioned in the meta-analysis and the systematic reviews, and all these factors impacting the effect of fasting on the cardiometabolic risk factors. Physical activity, whether to be observed or not to practice or not to practice during Ramadan, also affect the different ethnicities and the different groups that have been tested or studied. You know, fasting is observed by maybe all the ethnicities throughout the world, but there are different ethnicities with different genetic backgrounds have different responses to the observers of fasting. And this is our evidence also that people with different polymorphisms show different responses to the fasting during Ramadan with regard to the cardiometabolic risk factors. But there is no time to show this study. Different treatment modalities for the diabetes patients, whether on the oral hypoglycemic agents or insulin injections, all these also affect the outcome of fasting on the cardiometabolic risk factors. And the most important thing, which as I mentioned, was education. If there is education before Ramadan or there is no education for patients on diabetes before Ramadan, all these also will affect the outcome of fasting on cardiometabolic risk factors. So in conclusion, Ramadan fasting, fasting in general, intermittent fasting, and Ramadan fasting can induce favorable physiological changes in healthy people with regard to improving the lipid profile and other cardiometabolic risk factors. However, the evidence on Ramadan fasting and patients with diabetes, both types, is still limited, and the available evidence showed neutral to slight beneficial effects for observing Ramadan fasting by patients of type 2 diabetes on the cardiometabolic risk factors, and very limited evidence about the type 1 diabetes. So more controlled long-term studies exploring the effect of fasting on these factors is warranted, and more controlled and long-term studies should be undertaken. Major confounders like dietary intake, sleep, physical activity should be also controlled and considered in these forthcoming studies. Subgroup analysis is warranted to find out which is the best medication that is associated with the best outcome in cardiometabolic risk factors. ونختم بقول الله عز وجل وأن تصوموا خير لكم إن كنتم تعلمون اللهم بلغنا رمضان نحن على أبواب رمضان. قبل أن أختم, this is a cordial invitation for all of you and attendees and audience to share us and participate in our forthcoming conference on fasting. It is the first international conference on fasting that will be held in Sharjah University. You are honored to have Professor Hassanain on board in our scientific committee and one of our keynote speakers, in addition to Prof. Osama Hamdi and also Professor Mark Matheson, the first renowned person in the world with fasting and cognitive and mental health. It's our pleasure to have you and to meet you there in our conference. جزاكم الله خير. Thank you so much all of you. Assalamu alaikum.